I have to tell you about this digestive case. It's amazing. This guy was a referral from a local provider, and she kind of got to the end of what she felt she could do with him. Everything started in 2018, where he was having bloating starting, discomfort starting. They figured out that gluten and sugar made it worse, so he stopped eating those, but literally had bloating for hours during the day, was really uncomfortable and abdominal pain. And he tried the keto diet, he tried the carnivore diet, he tried the low FODMAP diet, did some SIBO testing, and did some Xifaxan, rifaximin. Nothing really changed his symptoms. And he was to the degree where even water or any food would just cause him to bloat up and be uncomfortable. So his solution was he wasn't eating. So he's losing all this weight. Not the best solution. So of course I started him on the GI1 powder, and he gave me GI1 powder for history, full dose. Okay, so he gave me a report when he was partway through his dosing, and he said that he was no longer getting automatic bloating, that his stomach was flattened, and he had tried to expand his diet a little bit into the area of meat, and that was helping for him. He was having a lot of fatigue, which I assured him that is a die-off reaction. That's good. You want to kill those guys. That'll go away eventually. And so then we did a follow-up a couple of days ago, and he told me basically he was asymptomatic. He was at the full dose of the GI1, and I was having him titrate down because he'd been on it for 12 weeks, which is a little longer than I do. Anyways, his stools were formed, no more diarrhea. He was not having any kind of excessive amounts of gas. He was not having bloating. He was not having abdominal pain anymore. That was so severe he couldn't eat, and he only had heartburn or reflux if he was eating his known inflammatory foods, which were sugar, dairy, gluten. So he was happy to stay away from those foods. And a little sideline with this fellow is that he had this really nasty thing happening with his feet. And what was happening with them is, let's just go down to, he was getting this leaky, acidic, chemical ammonia smelled like rotting meat. He was literally turning his socks yellow with these. So I automatically was thinking fungal. We took a sample, and it turned out that it was Cryptococcus, which is a fungal species. So we treated that topically with antifungals for him. And so all those things are getting better. I've referred him back to his primary care doctor.